Joining us to lead this discussion is Jason Langheier, the CEO and founder of Zipongo. Jason, good morning.
Good morning. How are you?
I'm great. How are you doing today?
Great day.
Hey, you out of San Francisco today?
You got it. Beautiful Presidio.
Yeah. Hey, I had the pleasure of spending time with Sheila not too long ago at Health Technology Forum. She was part of a panel I put together, and she did a great job. And that was the first time I really kind of got my arm around what you guys are doing. So I was really excited to have you on the program today. Tell our audience a little bit more. Give us a little backgrounder on Zipongo, and then we'll kind of get into more of the details of what you do and why you're doing what you're doing.
Sure. Zipongo is eating well made simple. And you can think of us as a virtual or automated nutritionist. We work with large self-insured employers and health plans, as well as hospital systems, to try to support them in helping their people eat healthier and actually achieve healthier outcomes. And the quick backdrop on myself is a physician and trained in public health at Harvard School of Public Health. But was really inspired to do this work after starting a pediatric obesity clinic at Boston Medical Center.
Okay.
So who are your clients? Are you selling products to insurance companies, directly to employers? Is there a direct-to-consumer option, or all of the above? What's your key market, and who should be looking for your services?
Great question. We support payers, so large self-insured employers, typically over 5,000 people, as well as large health plans, a number of Blues plans, small regional plans, and some of the big ones. I used to say the big six, but it looks like that's going to be about the big four soon. And we also support hospital systems.
Yeah. Hey,
how can somebody find, if you're working with hospital systems directly, how can somebody find out if their hospital is participating in your program? Is there a list or website they can go to, or is it just specific carriers that the hospital might be in their network?
That's a great question. As of today, we actually just support the employees of hospital systems, but I think in 2016 you can look to hear about hospitals and physician groups that are going to start to offer prescriptions for Zipongo to try to help their people eat healthier, and those codes will flow back to the health plan.
Let's talk a little bit about the user experience. What can the user expect, and what is that user experience with you?
Sure. It looks a little different if you use the free version of our app that you can find on the App Store, featured under Food and Nutrition or Android or the web, versus if you actually work at a large Silicon Valley company or a manufacturing company in the Midwest. If you use the free version, you can basically state what your food preferences are, like you might be vegan or paleo, you might have food restrictions, and then you can find recipes, put it to a grocery list, use that grocery list store, and then pull down discounts from all the major grocery stores in the United States to help make it easier to eat well. But in the environment of your employer group, for example, if you go to a biometric screening event, you might have your cholesterol, your blood pressure, your fasting glucose levels, your weight status. That data, when you opt in, will flow automatically to Zipongo. All of your health risk assessment data, if you opt in, would flow into Zipongo. And then you would do a dietary assessment on Zipongo, a food frequency questionnaire that would tell us about both your food preferences and your baseline nutritional status very quickly. That data would then be used to give you a personalized meal plan at the start, just like if you were to see a dietitian. And then ongoing, for example, if you went to the corporate cafe at your office, you would actually get a personalized mini menu on your phone and via email when you enter the threshold to the cafe, because we have these little Bluetooth beacons up in the cafe, and it would say, here's actually the 3 recommended choices for you. So think of it as like a healthy prefix menu, but according to your preferences. But then on a different day, you or your spouse might actually get a push notification that says, here's a recommended recipe to cook tonight, or on Sunday night, here's the meal plan for the week and the associated grocery list, with discounts actually already appended to it.
So Jason, if I'm a major employer and I'm considering Zipongo, what is the business? What is your business model for them? How is it priced? What can I expect? I mean, what's the business model?
Yeah, that's a great question. We do things on a per member per month basis. Like many organizations, we just look at the number of people in the eligibility file, and because food and eating affects 100% of the population, it actually proves to be one of the most important tools to drive engagement in health and wellness programming. I think that the other reason that we do it on a per member per month basis is because we then run campaigns across the entire organization to help drive people into these other wellness platforms, these broader wellness platforms. And simultaneously, we work in the cafes to actually draw people in to engage in their well-being. That said, we are actually doing some experiments with some of our clients where some of our clients actually fund nutritionist visits for a large percentage of their population. But a nutritionist visit is $75 a visit, whereas Zipongo is on the range of $10 to $50 per year for unlimited use. So when you look at it in those terms, there are many amazing and wonderful dietitians and health coaches out there, but not all of them are at the same level. And if you're trying to help your whole population, especially now with the Affordable Care Act's ruling, where you're supposed to give nutritional counseling to anyone who's overweight and with cardiovascular disease risk factors, it's hard to stomach $75 times such a large percentage of your population. So what we're trying to do is first-line therapy with something like Zipongo, and then people who actually improve, that's great. Keep them going with Zipongo and other digital tools. And people who still need additional support, then route them to telemedicine and live help from a dietitian or someone else.
That's a tough.
But really trying to help the cost system.
Yeah, engagement is kind of an abused term these days, and we all know engagement is so incredibly important. And some of the target audience that you're just talking about is a tough audience to get engaged. I mean, how do you work on and work with your clients and other partners to really get them engaged with the Zipongo app and your solutions?
That's a great question. So I'll use the example of, say, a Silicon Valley employer for a second first. So in that example, you have people coming in to do biometric screening events. In some cases, they get incentivized to do so. In other cases, they just do it because they see it as a free service that's helpful to learn more about themselves. And people, when they're sitting there waiting for their cholesterol result to come back, they actually will sit there for between 5 and 10 minutes just waiting. And so a person in the mind frame of, I actually want to improve my health, I've taken time out of my day to wait for this result, and so I'm quite curious to complete a dietary assessment, do other things. And the number one thing that people say coming out of a biometric screening event is, okay, I took the time to learn what my challenges are. Can you actually now give me specific, personalized advice for myself and my family as to what to do about it? And food is always the number one thing that people intuitively expect that they should get advice on to make a difference in their cholesterol or blood pressure, etc. The second point of engagement is the cafe itself. So every single day, an employer has 100% of its population eating multiple times a day, or at least we hope. And then, in many cases, the cafe has a lot of traffic, and many employers actually subsidize the food in the cafe. And so if that's all happening, you have a semi-captive audience of people who are relying on you for food anyway. So it's a wonderful opportunity to communicate with your people via the menuing systems themselves. So those are a couple simple examples. At the same breath, we also have a publication that was submitted by Drexel University for work we did with AmeriHealth in inner city Philadelphia. And in that environment, in a Medicaid population in that community, people aren't going to a Silicon Valley employer for work every day. They're not using email every day, and they don't have a cafe they go to every day. But instead, they go to church. There's where we did the biometric screening, and they use text message heavily. And so we were able to send them text messages every night with a personalized recipe for the family, and then every week a grocery list that already pulled in the discounts. And that's what made it easy for them. It saved them time, and people kept using the service, and it helped make them healthier at the same time. We dropped blood pressure 9 over 5 points, total cholesterol by 13 points, 70% lost weight. It was 9 pounds on average at 6 months.
Frank, what you're doing, I think, is a great need for, and I consider it to be perfect consumerism, and sort of what I would call the part of consumerism supported self-help, self-care. We know that in this country that at least 30% of the population probably is diabetic or pre-diabetic, maybe even a higher percentage if you include them all. What is your the main selling point to a lot of employers where there's a lot of potential diabetes or a lot of diabetes? Are you able to help that population first? A lot of the younger folks, are looking to and have been educated a little bit more than some of us older folks on diet and exercise. So what's your target diagnosis, if there is one?
That's a great question. So the way we look at things is, all of these biometrics, these outcomes, for example, blood pressure, hypertension, cholesterol, hyperlipidemia. When we look at the fasting glucose level, the hemoglobin A1C, prediabetes, diabetes. And in all of those cases, my mentor, Walt Willett from Harvard, Christopher Murray, who invented disability-adjusted life years, they've all reflected in their research that diet is the number one driver of what can actually change those outcomes and prevent those outcomes. So, we're a really nice adjunct to any existing kind of case management, disease management programming that places have that might superficially cover nutrition, kind of talk about it at a high level, a population level. But if you really want to make a difference, just like on the show The Biggest Loser, the things that happen in the background on that show that you don't necessarily see on the show is they've fundamentally restructured the environment for people who come onto the show, like literally change the way that food is organized in their living quarters, the way in which food is purchased. And those changes in default behavioral economics are the things that, on a personalized basis, make it easy for people to eat well, that then lead to changes in blood pressure, changes in cholesterol, changes in diabetes. But if you have a different kind of disease state, your diet might vary a bit, and we reflect that in our system, personalized manner. Though that said, personalizing to your personal food preferences and your cultural preferences, that's actually even far more important to actually help you follow through with the recommendations. And that's what's not often done well in other systems today.
Jason, one last quick question, then Doug will get you to wrap up. For our listeners out there thinking about this area, how are you different than, say, Weight Watchers or Jenny Craig, or are you working with them to provide supplemental services that they don't have? Are they competitors? What's the dynamics there?
It's a great question. Companies like Weight Watchers, just like companies like Virgin Pulse and WellTalk on the wellness side, lots of great companies, and we're actually working with many of the wellness platforms, in fact, most of the wellness platforms, and we have just started working with a handful of the weight loss programs. Because again, Weight Watchers is a good example. They have a points program, and it's great, but they don't really have a complete set of tools that tap into the cafe food recommendations at the employer level, for example. So it's a nice adjunct to have those go hand in hand. The power of something like Weight Watchers and Jenny Craig is the group component with other people, which we don't do. But the power of what we do is integrate with all these daily life tools like the cafe recipe menus, as well as the discounts from the grocery stores. So it's a nice union.
Jason, it's been really good having you on this program, and I love what you're talking about. I think it's just another example of really positive innovation taking place in this space, and I commend you for the work that you're doing there. Give our audience a couple takeaways, and then let them know how they can get in touch with you, please.
Sure. I think the summary is that Zipongo is eating well made simple. And we're a company that large employers and health plans call on to make a real change in the health and biometric outcomes for their population, and also to drive really high engagement in their population, since 100% of their people eat multiple times a day. We're currently the leading company in size and scope and number of clients and lives as it relates to personalized healthy eating recommendations and tools for the enterprise. If you want to reach us, feel free to actually shoot me an email at the letter J at zipongo.com or visit our website at www.zipongo.com. Thanks, guys, for the time today.
Yeah, thank you, Jason. Have a great weekend out there, and hopefully we'll talk soon.
Likewise. Take care.